Have you ever looked down there and noticed things just look different than they used to? Maybe the color has changed, or something looks darker or different than what you remember, and you're not quite sure if that's okay or if something is wrong. First of all, you are not alone. This is one of those things so many people wonder about and almost nobody talks about. So today, we're going to change that. My name is Gig Nurse, and I'm a health educator. And in the next few minutes, I want to walk you through exactly what's happening with your vulva during puberty, why color changes are completely normal, and how to tell the difference between something that's just part of growing up versus something that actually needs a doctor's attention. Let's dive in. Let's start with the basics, because honestly, a lot of people weren't taught this stuff, and that's not your fault. The vulva is the external part of the female anatomy, and it includes the labia, which are the folds of skin on the outside, as well as the area surrounding the vaginal opening. Now here's the thing. The vulva is not static. It changes throughout your entire life, and some of the most significant changes happen during puberty, which typically begins anywhere between ages 8 and 13. So what's actually driving these changes? The answer is hormones, specifically a hormone called estrogen. When your body starts producing estrogen during puberty, it sets off a whole cascade of physical changes, and your vulva is very much part of that process. The tissues thicken, the labia grow, and the color of the skin shifts. This is all completely expected and supported by medical research. Here's what's really interesting about the color piece specifically. Before puberty, the vulvar tissue tends to be quite thin and delicate, which means the blood vessels underneath are closer to the surface. This actually makes the skin appear brighter pink or even reddish. As estrogen increases during puberty, that tissue thickens and matures. The cells start doing more work, and as a result, the color deepens. You might notice the labia becoming a darker pink, mauve, brownish red, or even a deeper brown depending on your skin tone. According to the American College of Obstetricians and Gynecologists, in adults, the vulva can range all the way from light pink to dark brown or nearly black, and all of that is within the range of normal. Ethnicity and individual genetics also play a huge role in what your vulva looks like. There is genuinely no single color that a vulva is supposed to be. Now let's talk about another reason color changes happen, which has to do with melanocytes. Those are the cells responsible for producing pigment, the same cells that determine the color of your skin, hair, and eyes. Here's the thing about melanocytes. They are especially sensitive to hormones. When estrogen and other hormones surge during puberty, those cells in the genital area respond by producing more melanin, which is the pigment that causes the skin to appear darker. It's actually a similar mechanism to what causes the skin on your stomach to darken during pregnancy, something called the linea nigra. So the darkening you might notice on your vulva or inner thighs during puberty is your body's melanocytes responding to hormonal shifts. It's biology, not a problem. Something else worth mentioning is that your vulva is also likely changing in other ways at the same time, and that can feel like a lot. The labia minora, the inner lips, often grow larger and may extend beyond the labia majora. Research shows that labia length can vary widely, and just like the color, there's no one correct shape or size. You might also notice that your two sides aren't perfectly symmetrical. That is extremely common, especially in the early years of puberty when everything is still growing and developing. Real talk for a second. A lot of people feel embarrassed or even alarmed when they notice their vulva looking different than images they've seen, whether online or anywhere else. Here's what I want you to know. A huge portion of images out there do not represent the actual range of normal anatomy. They often show a very narrow and honestly unrealistic version of what vulvas look like. The medical community is clear that there is enormous natural diversity in vulvar appearance, and that diversity is healthy and normal. So what should you be aware of when it comes to changes that might warrant a doctor's visit? Most color changes during puberty are normal, but there are a few things to look for. If you notice redness that's accompanied by itching, burning, or unusual discharge, that could indicate an infection and is worth getting checked out. If you see a new dark bump or a spot that's changing in size or shape, it's a good idea to mention that to a healthcare provider, not because it's likely serious, but just to be safe. And if you have any color change that comes with pain or swelling, that's also worth a conversation with a doctor. The key word in all of these is accompanying symptoms. Color change on its own, without discomfort or other signs, is almost always just puberty doing its thing. Here's the bottom line. Your vulva is going to change during puberty, and color is one of the most common things that shifts. It gets darker, richer, and more pigmented because of hormonal changes affecting your skin cells. The tissue thickens under the influence of estrogen, which also changes the appearance. Your labia may grow and may be uneven. None of this means anything is wrong. It means your body is doing exactly what it's supposed to do. You deserve accurate information about your own body, and the fact that you're here, asking these questions, is genuinely something to feel good about. The more you understand about what's normal, the better equipped you are to notice when something actually isn't, and to advocate for yourself with a healthcare provider if you ever need to. If you found this helpful and want more content about puberty, body health, and understanding your own anatomy, go ahead and subscribe. I'm here to answer exactly these kinds of questions, because everyone deserves to understand their own body. Thanks for watching, and I'll see you in the next video.